and welcome to How to Gastro. In today's video, we're going to be talking about a very interesting topic, and that is Barber's itch. So let's get started. So what is Barber's itch? Tinea barbae, which is also commonly known as Barber's itch, is a fungal infection of the skin, hair, and hair follicles of the beard and mustache area. The disease is a type of dermatophytosis and is most often caused by two species of fungi, Trichophyton mentagrophytes and Trichophyton variocosum. The infection most commonly occurs in older teens and adult males. So from this definition of Barber's itch, we get that it's also commonly known as Tinea barbae and is a fungal infection which most commonly occurs in older teens and adult males. So the infection most commonly affects the skin, the hair, and the hair follicles of the beard and the mustache area. And the two main types of specific fungal species which is involved in the infection include Trichophyton mentagrophytes and Trichophyton variocosum. So this is actually an image of what the Trichophyton mentagrophytes species looks like on microscopy. So now that we know what the basics of Barber's itch is, let's take a closer look at how one can contract the disease. So the cause of Tinea barbae is most often zoophilic, which means it comes from an animal fungus. Trichophyton variocosum actually comes from cattle, and Trichophyton mentagrophytes actually comes from horses. And the disease is most frequently passed to humans from these animals. So agricultural workers are the most commonly infected people with Barber's itch, and the disease is also contagious and can be passed from person to person from contaminated objects, such as towels and pillows to a person. So the majority of people who actually suffer from the disease actually get it from an animal source, such as cattle or even horses. Some domesticated animals such as cats and dogs have also been said to cause the infection, but the majority of cases actually come from cattle and horses. So the fungus actually causes similar signs and symptoms in these animals, and then the infection can be spread to the human host. So something very interesting about this disease is that in addition to one's likelihood of catching it from cattle or horse or domesticated pet or animal, it can actually be spread from person to person through the sharing of contaminated objects such as towels or pillows, or even if one visits their local barber who actually uses specific grooming tools on their beard or mustache area and doesn't actually clean out these objects carefully, the fungus can actually be spread from person to person. And in this way, one can also contract the disease. So moving on, let's explore some signs and symptoms now. So the majority of patients will experience this rash which occurs in that mustache or beard area. So the patients will experience a rash with swelling and marked crusting. So as we can see in this image, it shows us the swelling and then the crusting on the surface of the skin. There will also be red and lumpy areas around the face, as we can see here. They will also experience severe itching, and they will find that when they have this rash, their hairs can be easily pulled out and their facial hair will break off easily. And the rash is often accompanied by a bacterial folliculitis and inflammation secondary to ingrown hairs. So in addition to this fungal infection, which causes this typical rash, these patients will now be more susceptible to the development of secondary or opportunistic bacterial infections. So because that skin in that affected area loses somewhat of its immune fighting capability, these patients will now be more susceptible to develop secondary bacterial infections as well. So these are all the signs and symptoms that one can experience in Tinea barbae. The diagnosis of Barber's itch. So the doctor is likely to diagnose Barber's itch simply by looking at the typical skin rash aspect and from the history of the patient, meaning interactions with farm animals and lifestyle experiences. So the confirmation of the diagnosis can be done by identifying the fungal element on a potassium hydroxide wet mount from plucked hairs, a culture, or a biopsy. So essentially, the doctor can actually put the clinical diagnosis of Tinea barbae, but if we want to confirm the diagnosis, we can actually take skin scrapings, plucked hairs, or even a biopsy and send these off to a lab so that these specimens can be either cultured or they can be viewed microscopically. So microscopically, we'll be able to see those fungal filaments from the skin scraping sample as well as the plucked hair samples. And in this way, we can accurately confirm the diagnosis of this disease. And finally, let's talk about the treatment of Barber's itch. So most cases of Tinea barbae are treated with oral antifungal medications such as terbinafine, itraconazole, griseofulvin, fluconazole, and ketoconazole. So the majority of patients actually suffer a severe form of the rash, and therefore all medications are usually indicated here. But in some patients who have a very mild or less severe form of the disease, they can actually be treated with topical antifungal medications such as fluconazole or ketoconazole creams, but the majority of patients actually are usually treated with oral antifungal medications. And that brings us to the end of this video on Barber's itch. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And please make sure you turn on your bell notifications so you'll be notified every time we have a new upload. If you'd like to download a copy of this presentation, you may do so by clicking the link in the description. Take care and bye for now.